And the White House has unveiled its plan to roll out COVID vaccines for children ages 5 to 11, pending FDA approval.
That's right, Hazel. The Biden administration says it has secured enough supply to vaccinate 28 million children. It also will mobilize vaccines to more than 25,000 primary care offices, tens of thousands of pharmacies, and hundreds of schools and community-based clinics.
Now, earlier this week, Governor Kathy Hochul said she expects federal approval to come sometime in November. She also urged local clinics and pediatricians to start getting prepared now. So joining us this morning is Dr. Dyan Hes. She is the founder and medical director of Gramercy Pediatrics in New York City. Dr. Hes, thank you so much for joining us this morning.
Oh, thank you for having me.
Dr. Hes, what are you hearing in your clinic from parents that are coming in? Are you finding there is a high demand to get their children vaccinated?
Well, my clinic is a little biased because I have a private practice and all of my patients have to be vaccinated in my practice. So I have a very pro-vaccine population, and they are desperately awaiting the arrival of this vaccine. They ask every day.
Yeah, can you talk about that vaccine? Is it
Sure.
a half a dose? I mean, people are really worried about it.
Yeah, so last night we were so fortunate. The New York State American Academy of Pediatrics organized a webinar, and we actually had the governor on as well, and she spoke with us. So the dose is going to be 10 micrograms, which is a third of the current Pfizer vaccine dose, but it's not going to be the same vial. So we're going to receive new vials with a new concentration. What's also going to be amazing about this new rollout is that this Pfizer vaccine doesn't have to be at that very low temperature. So you don't need that super duper freezer. It can be stored in a regular freezer, and it can be stored in a regular refrigerator. So this is going to be much easier to have it in schools, in pediatrics offices, and health clinics. So the rollout would be much, much easier. You won't have to go to like a Javits center or a place where they have these super low temperature freezers. So, and you cannot dilute the vaccine that you already have. It has to be the pediatric dose.
So I had the Pfizer vaccine, obviously the adult dose, and I was out for 2 days. So I'm wondering, what are the symptoms that young children typically have after getting vaccinated against COVID?
You know, it's going to be the similar thing, like fever, maybe muscle ache, some lethargy. You know, nothing more serious than that. Probably everybody you spoke to reacted differently. I had 3 Pfizer vaccines, and with every vaccine, I had a different kind of reaction. Nothing that like was more than, you know, a little bit of muscle ache and that wasn't resolved for me with some Tylenol or Motrin. So that we'll have to see, but we're not expecting any major reactions. You know, of course, if our patients are not feeling well or tired, we'll write them a note that they stay home from school the next day, because the benefits of getting vaccinated are so much better than not being vaccinated.
Dr. Hes, do you anticipate there'll be enough vaccine for everyone who wants it for their children come November, or should parents be prepared to wait a little while?
I think there's going to be a surplus of vaccine. Sadly, the polls still show that only about 1/3 of parents want to vaccinate their children for COVID, and I think that they have secured 28 million doses is phenomenal. I wish we would use them all up. That would be my dream. But I think that the first batch of people who are waiting desperately are going to pour into their pediatricians' offices to get the shots, and then there's going to be a lag, and then we're going to have to show some families who are vaccine hesitant how great this rollout is and that it's really working for the children.
So, of course, at this point, we don't know if it's going to be a couple of weeks, when exactly in November that these vaccines could roll out. But should parents consider making appointments right now with their pediatricians, or is that a little premature?
You can't. I don't think you can make an appointment right now. So what we were told is that today we can start ordering the vaccine.
Okay.
But it has to get it's going to have emergency authorization use, EAU approval. And then when they start shipping it to us, then we can make appointments. I don't think it's going to be so hard to get an appointment. I think if you want a vaccine, I mean, I know for my office, we're going to open on Saturdays or Sundays to make sure everybody who wants it can get it. And I think that's what most people, I mean, listen, it is as a pediatrician, it is in our best interest to get our patients vaccinated. So we're going to do everything in our power to do it. I know some pediatricians were worried about like the cost. Is it going to be a cost to them? The vaccines are actually being sent with syringes. So the pediatrician doesn't even have to buy syringes. And I think the pediatricians, they say, are going to be reimbursed $40 per vaccine, which is about the cost of the time and the administration of the vaccine, giving the card, getting the patient checked in, and all that kind of stuff.
With adult vaccinations, they say that it's safe to do the COVID vaccine along with your flu shot. So is that the same with kids?
Absolutely, yes. You could do it with any of the other pediatric vaccines at the same time.
Okay, great. That's great to know.
Good question.
Yeah, thank you so much, Dr. Hes, for your time. We really appreciate it.
Thanks, Dr. Hess.
Thank you. Have a great day.
You too.